Back with you tonight. The Chris Hani-Baragwanath Academic Hospital in Soweto has had to cancel nearly 900 operations this year due to shortage of linen, load shedding and cable theft. That's according to, of course, the report that was brought by the Democratic Alliance, and I see the MEC having confirmed that as well. Now, adding to its woes are dysfunctional boilers, but the Gauteng Department of Health saying it is working hard to reduce the number of cancellations. Joining us now to tell us how they are working on mitigating measures is the chairperson of the Medical Advisory Committee at the Soweto Health Facility, Professor Mmampapatla Ramokgopa. Prof, good evening and thank you very much for your time and for joining us tonight on In Focus. According to the Democratic Alliance, the shortages there appear to be because of broken machinery at the hospital's in-house laundry. That's the question then of the linen. How serious is the situation?
Good evening, Tabo, and listeners and those that are watching, and thank you very much for inviting me. And let me take this opportunity to also express our sincere, appreciation of the work that you are doing to amplify, some of the problems that we've been raising up in our public healthcare facilities. Now, closer at Chris Hani-Baragwanath Hospital, yes, currently, especially with COVID, that we've just gone past, we've been having serious problems with, amongst others, the cancellations of patients that were booked for operations, and this has been because of the ailing infrastructure, whether you call it deficiencies as far as laundry machines, poor linen supply, the autoclaves that have not been working optimally, but also the sheer constraints as far as the resources that are available, for the masses of our people that we're supposed to be serving.
Yeah. Is there anybody who's sounding the alarm, raising their hands, saying we are drowning here? I mean, when you see those cancellations go up from 10, 20, 100, 400, 500, now they're sitting at 100, and I'm sure they continue to go up. Is there a sense that somebody is raising the alarm and there's a marshalling of forces around coming up with interventions?
Yes, Tabo, I mean, there's a lot, in the press, yourselves, on this TV station and other TV stations, in the print media, there's been a lot written and said about, the problems that the public health systems, hospitals such as Baragwanath are experiencing. And you also take note that over the past week or so, there was the whole question of one of our colleagues at Rahina Musa Hospital, Dr. Tim Demeyer, who came up, in the open, in the print media, highlighting some of the problems that we are currently experiencing. The problems that Dr. Tim Demeyer raised concerning, Rahina Musa hospitals, these are the very same problems that are experienced in all our other hospitals. And if those problems can be experienced at the teaching hospital, such as Rahina Musa, then you can just imagine what is happening at smaller hospitals, such as Tambo Memorial Hospital, Pulusong, Far East Rand, Laradong hospitals, and so forth.
Yeah.
So this is public knowledge. These matters have been raised, debated, but often, they end up as just being discussions that political parties are tossing, around between each other, and with no long-lasting, solution being brought to the fore.
Yeah.
There are great policies that dictate as to what is the quality health care that is expected to be delivered. There's a lot that is being debated. Media responses, like the media response that we saw yesterday from the response in Parliament on the question of the cancellations at Bara. Yes, it comes up with very good things that says we've done this and this, we're going to do this. But in essence, for those of us that have been on the ground, especially those that have been there long enough, you realize that lots of it end up as just being, cheap talk.
Yeah.
There's a lot that needs to be done in terms of ensuring that you've got people with an insight, people who've got an interest, people who've got the will and the capacity, to identify what are the real problems at places like Hani-Baragwanath Hospital, but not end up there.
Yeah.
Engage with the critical internal stakeholders in identifying those problems in detail and working out as to what are the immediate and long-term solutions. But often, that does not happen. All this will end up as a talk show in Parliament or in the papers and so forth. And for us that are working there, it can be so frustrating.
Is this, in your view, a political issue, or is this an incompetence at the level of administration in terms of management that is being put at managing these hospitals?
I think it's a combination. It's a combination in that, look, politicians, political parties in their manifestos, they'll all come up with all brilliant stuff as to what is it that the people want and what is it that the people deserve and what is quality health care service and so forth. But I can tell you, often, like I've said, it ends up just the good policies, right? So political parties making the right pronouncements and so forth. But at the end, there's no will to take it beyond just that. And that will also entail that identifying the right people, the people with insight, as I've said, people who've got the capacity, to be able to grapple with these problems. And that is what is lacking. So there is the technical know-how and the determination to make things happen. And on the other hand, the political support. So the two don't seem to be talking to each other. Sometimes when you listen to our politicians making statements, talking and so forth, and you work in that environment, you ask yourself, but in which world do these people live? Yeah. And we say that for us, if you're talking about quality health care, we're also talking about, delivery, of that quality in a quality manner, in a quality environment, and in a manner that will have quality outputs. And all these things are things that are not followed to the detail. Right. And the political will is a problem. Yeah. And secondly, people with capacity, right, and people who are able to ensure that problems are tackled and that they are long-lasting solutions.
Prof, appreciate your time. Thank you very much for coming on. Professor Mmampapatla Ramokgopa, chairperson of the Medical Advisory Committee at Chris Hani-Baragwanath.